Hey, hello, good morning, everybody. I'm at my center. I reached my hospital. So today, one kid came to me with an injury in his eye. He got this hurt because of a cricket ball. It was a cricket ball injury. He had blood inside his eye. So the blood outside the eye is not much of a problem. But if it is inside the eyeball, then that is where the problem arises. So there are various compartments in your eye which can have blood, right? So depending on the structure which has blood defines the severity of the disease. Okay, so there's a part of the eye which is called the anterior chamber, which lies between the cornea and the iris. So there, if there's blood there, then what happens is that it might block the drainage pathways of the eye. So if that happens, the IOP of the eyeball rises. By IOP, I mean the intraocular pressure. The intraocular pressure of the eyeball rises, which may lead to the damage of various structures inside the eye. So, starting from the cornea may become hazy. Okay, if the intraocular pressure rises, then the perfusion of the iris decreases, which may lead to ischemia of the iris. By ischemia, I mean the damage to the iris tissue because of the lack of oxygen, because ultimately what we are getting from blood is oxygen. Okay, then after that we have the lens. So there are ischemic changes in the lens as well. Then the vitreous is basically avascular, so not much of a change happens to that. But then the retina health is also get compromised, because of which we may have a white retina or an edematous retina. So by edematous retina, we mean that there's swelling inside the retina, because of which the patient is not able to see clearly. And then there is the optic nerve, which is the most important structure when it comes to the transmission of impulses from the eye to the brain. So if there is any damage in the fibers of the nerve, then definitely the patient's vision is going to be compromised. Okay, so these fibers of the nerve fibers, they also get damaged because of the increased intraocular pressure. So we might want to reduce the intraocular pressure first of all, and then we may want to give treatment for the blood which is inside the eye, and there are sufficient eye drops for each of these things that we give, and also some oral medications if we want. Some, maybe if there is any kind of infective signs of infection that we see, then we may want to give an antibiotic for that as well. So that depends from case to case basis how are we going to treat it. But you may want to know that any kind of blood in or around the eyes is very important, that needs an immediate consultation, immediate expert opinion from an ophthalmologist. So kindly go to your nearest ophthalmologist for any kind of blood in your eye. Okay, this is me, Nada, signing off. Bye bye. See you again tomorrow.